Welcome to Healthy Living. I'm your host, Melissa Hodgson, and we're talking today about the opioid crisis and about physical medicine and rehabilitation. We'll be talking with 3 members of the staff at St. Tammany Health System who have a special focus on pain management, the opioid crisis, and on physical therapy and rehabilitation. We'll talk first with Dr. Mike Hill. He's Vice President of Quality and Utilization Management for St. Tammany Health System. And then we'll talk with Jay Morange and Bert Lindsay, who are leaders in the Rehabilitation Services Department at the health system. So Dr. Hill, thanks for joining us. Good morning.
Good morning, Melissa.
Thanks for coming out.
Oh, you're welcome.
Glad to have you here. And I know that you really have led an eye view at the health system about the opioid crisis, about it as an epidemic. And your background is in disease management,
right.
So that's kind of an interesting connection there.
Right. So I'm involved with population health at St. Tammany Health System. And one of our initiatives that started about 3 years ago was reducing opioid use in our hospital as well as our outpatient setting. We are all now aware that we're in the midst of a serious opioid crisis, and our community has been part of the problem as well, as far as the number of opioid deaths and the number of people who are dependent on opioids. Certainly when used in the right setting, opioids are valuable treatment options for people who have severe pain, in short-term pain management, and in some cases longer-term pain management. But we're looking for opportunities to look at treatment options that avoid opioid use altogether or minimize it in patients.
Okay, and so I think you've brought up a couple of really important points there, because of course, like a national recession, a national epidemic, you don't necessarily know you're in it right away. You realize you're in it when levels hit certain markers. So here locally in St. Tammany Parish, we recognize that we are part of that national epidemic, and we do have a situation in our parish where there is maybe an overuse of opioids. But you're right, these are a very valuable tool in the care of populations and people with particular diseases or chronic conditions, or sometimes just acute and temporary pain may need those opioids, but we want to recognize that there are positive and negative ways to prescribe medications. And so can you talk a little bit about what we're doing at St. Tammany Health System to sort of look at that in a more systematic way of using rehabilitation and medication for the benefit of our patients?
Sure, I'd be happy to. So a couple initiatives we took is, number one, educating physicians and practitioners on the proper use of opioids. Because I think a lot of us grew up in an era where opioids were something that we just did every day, and we didn't think about the ramifications of the potential for addiction and some of the downhill side effects of these medications. And so I think, number one, training physicians on the proper use of opioids, really gearing prescriptions to shorter prescriptions, reducing refills, reducing dependence on opioids, and in many cases, using other modalities to avoid opioid use altogether. It's much easier to treat pain in individuals who have never been exposed to opioids. Other modalities seem to work better. And that's something that we started at St. Tammany, was really a team approach, utilizing our physical therapist, utilizing other medications, and in some cases using other modalities to block pain altogether that did not involve medications. And that's where Bert and Jay are going to talk about later on in this presentation. We started in the hospital setting with our hospitalist in reducing opioid use. We worked with the Society of Hospital Medicine and became one of the leading hospitals in the country on reducing inpatient opioid use. And since then, we've expanded that to the outpatient setting and into our community. You know, last year in 2018, we had 63 opioid-related deaths in St. Tammany Parish. Our goal is to get that close to zero, as close as possible.
Well, that's exciting progress. And so you've talked a little bit about kind of that big picture and then localizing it, and certainly our health system has been a leader here locally and recognized nationally for that excellence. Can you talk a little bit about whether technology plays a role in our opioid reduction?
Yes, this is a very good question. So several things that we're doing. We track the opioid use both by patient use and physician prescribing habits, and we do that with the Board of Pharmacy. Every physician that prescribes controlled substances has to be on a prescribing reporting tool with the Board of Pharmacy. We also track it in the hospital, and we look at the number of what we call morphine equivalents that patients are given and per doctor. And so physicians are able to look at their own prescribing habits, and that gives them feedback on what they can improve on. And since we've gone into effect with this in our emergency room and in our hospital, we've seen a 30 to 40% decline in opioid prescriptions.
Wow. And you're able to measure that because you're taking the time to make those records.
Right. And the other thing that we've developed are tools that educate the patient into what the goals are and what we're trying to achieve, and that it's not always a pill that solves the problems. It's multiple modalities that help reduce the pain altogether. And so I think that the team approach really has served us well at St. Tammany, both in our inpatient setting and our outpatient setting at the hospital.
Fantastic. Can you sort of look into your crystal ball and talk to me about where you see St. Tammany Health System and its opioid program, or its maybe pain management program is a better way to say that, in the next 5 years?
I think in the next 5 years you're going to see more emphasis on, again, the team approach, looking at other modalities. I think we'll see opioids still have a niche in certain areas, but there'll be short-term use for the most part. In certain areas, we do use long-term opioids, but they're done in a different type of use and delivery model so that patients are less likely to become addicted. So I'm hoping that in the next 5 years, and I think we have a very good strategy put together, that we're going to see a marked reduction in our opioid use in our community, both in the inpatient side and the outpatient side. We'll use more rehabilitation modalities and dry needling, et cetera, to reduce the pain thresholds so that patients can learn to tolerate and manage their pain.
Outstanding. So it's going to be a combination of education, prescription, other modalities like physical therapy, and that strategic approach using technology to track and monitor and understand that use.
That's correct. And I think artificial intelligence is going to play a significant role, because we'll be able to put certain information into our electronic medical record that may flag this is a patient that is high risk for opioid dependence, and then try to work with the other modalities to reduce the opioid exposure for that particular patient.
Very good. Well, Dr. Hill, thank you so much for coming in. It's been a pleasure to talk with you.
Thank you, Melissa.
Up next on Healthy Living, we'll be talking with Jay Morange about physical therapy and rehabilitation and its role in the reduction of opioid use in St. Tammany Parish.